Hi everyone, welcome to this presentation. I'm Chun-Hua Tsai from the University of Nebraska at Omaha. The topic for today is with help from Afar, cross-local communication in an online COVID-19 pandemic communities. This paper is a cooperative work with the researcher in Penn State. COVID-19 spread from a region to another. According to WHO, the new coronavirus was first identified in early January 2020, shortly after an outbreak in Wuhan, China. The virus then spread to the countries throughout the world. Although hit by the same pandemic, people from different geographic locations may have different experiences with risk prevention and crisis responses at the same time. For example, one area might experience a growth of cases while another maintains a low infected rate. Based on that, we argue COVID-19 pandemic is no longer geographically confined. The coordination of medical supply and exchange of latest scientific knowledge has needed to happen across multiple locales. In this paper, we would like to explore how people from dispersed places can work together in responses to global pandemic. We introduce a concept of cross-local communications. The concept is used to describe how people from different locales engage in communications. It denotes a specific type of crisis communication in which the communication content is impacted by two or more distinct and geographically dispersed contexts, experiencing the same crisis. This concept extended from the crisis communication that concern only one local context. For example, a person in Paris might view and respond to the tweets about hurricane in Atlanta, USA. The person's communication only involved the crisis context of the United States. In this case, this is not considered cross-local communication due to the viewer was not experiencing the same crisis locally. In this paper, we aim to answer how has the information about two or more geographically dispersed contexts impact crisis communication during the COVID-19 pandemic. To answer these research questions, we investigated the cross-local communication in an online migrant community that created by overseas Taiwanese during the pandemic's outbreak in March 2020. We choose a migrant community as our study context because online migrant community are typical examples that members come from different countries. We perform an inductive semantic analysis of the group discussions, messages, and interaction that took place in an online Facebook group. Based on the analysis, we identified four types of cross-local communication, including situational updates, risk communication, medical consultations, and coordinations. The first type of communication is cross-local situational updates. It refers to how people from one specific region share information about local situations, such as statistics, predictions, policies, and responses. For instance, an emergency responder from Taiwan shared their local condition in late March. In this example, he shared their local situations and experiences and invited questions from the communities. The cross-local situational update prompt a cross-comparison of the different policies, medical professionals' preparedness, and local policies. For example, medical staff in UK compared the UK and Taiwan's preventive measures, took the preventive measures recommended by Taiwan, and worried the local general public and authority in UK was not prepared for the pandemic. Situational update regarding the conflict between the migrants' local masking policy and the policy in Taiwan. This conflict caused a major concern in online communities. For example, a physician from USA need to communicate with their hospitals to change the policy of wearing masks in the workplace. In cross-local risk communications, the members shared resources with others to assess the risk associated with COVID-19, including risk prevention and the reasoning process behind preventive measures. For example, some members had to make high-stake decisions by assessing the degree of risk associated with the different locals. It was important for them to seek information about more than one places. One of the typical cases is international travel. In late March, one poster from California sought to advise to help assess the risk of their parents' travel plan back to Taiwan. In this example, the poster and the commenter engage in a cross-local risk assessment where they share information about the risk associated with two places, California and Taiwan. This provision of risk information about two locals in cross-local communication supported the collective process of risk assessment where the community members work together for high-stake decisions like international travel. In the online community, we observe the people frequently conduct online medical consultation because they have limited access to regular offline health services. Such online medical consultation allow people to seek health professionals' advice on a range of issues and receive the possible diagnosis and personal care advices. Unlike the typical one-on-one clinical consultation with local doctors, in the online community, the medical consultation happens cross-locally. And health professionals from all over the world provide free consultations services to the migrants during the COVID-19 pandemic. We also find a form of cross-local coordinations where people from different places could coordinate on the ground for crisis responses. Many people comment they are willing to help. For example, a poster presents how a migrant community could offer emotional and in-person local help to each other during the pandemic. Another common type of cross-local coordination was the offer of local grocery or supply delivery. For instance, a Taiwanese restaurant owner in Netherlands offered food to frontline healthcare workers. The online migrant community also supports cross-local coordination between multiple locals, like mask donations. It was one example of cross-local coordination showing how the online migrant community could facilitate the coordination of cross-local delivery of medical supplies. In this paper, we find public health crises such as COVID-19 pandemic are distinct from the regional crisis. In regional crisis, local and hyperlocal information about one place is important. But during COVID-19 pandemic in our study, local and hyperlocal information about two or more places was utilized in crisis communications. The migrant group members already had access to their local information, but still sought information about the other places in order to navigate their local public health crisis. We find cross-local communication involves a complex cross comparison of information such as situation, policy, risk, measures, and from different locals. We find the cross-local communication entails social support to exchange local and hyperlocal information. We also introduce multiple types of support in this paper. Our research implies social media can be part of the local and cross-local socio-technical system that coordinate with experts and authority in the organization as a whole. The system could help the people in the same or different locals have better crisis communications during the pandemic. In our paper, we also highlight the challenge to migrants during the COVID-19 pandemic. Please find more information in the paper. I would like to honor all my collaborators. Please contact us if you have any question or feedback. Thank you for listening.